Welcome back, guys. I hope you are all doing well. So, today's my topic of discussion is the third part of the temporal lobe, which is Wernicke's area. Okay, so first I draw the structure and tell you the area and then related function. What are the functions of the Wernicke's area and related pathway, how our body controls the Wernicke's area, and how you can understand the sentence, and how you can answer it against that sentence. Okay, so first I draw the structure related to the Wernicke's area. This is our brain. Okay, so the first area, which is just inferior to the lateral sulcus, is primary auditory cortex. Second area is auditory association cortex. Okay, which I discussed in previous videos. Now today's my topic of discussion is Wernicke's area, which is present over here. Okay, what are the name of this area? This is Wernicke's area. Later on in this lecture, I explain the clinical importance of Wernicke's area and clinical feature appear in the patient when there is damage to this Wernicke's area. Okay, I also draw some structure which are associated with that pathways. What is this area in blue color? This is primary visual cortex. I have to draw some more structure here in the frontal lobe. Okay, so today's my topic of discussion is red area, which is Wernicke's area. Okay, what are the function of the Wernicke's area? Basically, its function is to understand the meaning of the sentence, the tone of the sentence, what the other person speak to you, and you have to understand the sentence, what are the meaning of that sentence. Okay, and with response to that, you have to response it. Okay, this is the function of Wernicke's area, to understand the meaning of the any other sentence. Okay, any other person. Okay, through what are the pathways involved to the Wernicke's area, you have to draw it. So all the stimulus which comes from the primary visual cortex. Okay, someone talk with you and you have to see the person, so the visual stimulus. Okay, first one is visual stimulus, second one is auditory stimulus, primary auditory cortex and auditory association cortex, second stimulus. Okay, you also hearing the sound of the other person and also you can see the other person. Okay, there are two stimulus which initiate the Wernicke's area. Okay, all the information from the visual stimulus and all the information from the auditory stimulus process in their respective areas. Okay, process in their respective areas, and after the processing, okay, the information goes towards which area? Wernicke's area, from the auditory also, from the visual also. Okay, here we can understand. Okay, in the Wernicke's area, you take the information from the sensory and visual stimuli and understand what type of the meaning of it. Okay, what are the meaning of this sentence? Okay, later on I explain the clinical importance of Wernicke's area. If there is damage to it, what happens in the patient. Then after that, the Wernicke's area receive the information and send that information towards the Broca's area, which is present in the frontal lobe. Okay, when you have a sensory information which comes from these two pathways, okay, there is a sensory and also there is a motor. Because of the motor activity, you have to respond to that person. Okay, you have to answer to that person, so you have also a motor control through the Broca's area, which control the muscle of the speech. Okay, so what are the pathway involved in this transport of signal from Wernicke's area to Broca's area? What is these pathways related to that, and what are the structure related to that? Articulate fasciculus. Okay, fasciculus is the structure. Okay, so now the information sent towards the Broca's area, and you know the Broca's area, what it controls. Okay, it controls what type of muscles of your face, facial expression, facial speech muscle. You have to produce a speech and you have to answer the respected answer. Okay, you have to respond to the question. Okay, what you hear, what you see, all the information goes towards the Wernicke's area, and Wernicke's area send this information to the Broca's area, and Broca's area respond by speak. This is your mouth. Okay, this is like a duck mouth. So you have to speak from your mouth under the control of Broca's area. Okay, these are all the pathway related to Wernicke's area and associated structure. How the information goes towards the Wernicke's area and how we can respond, how we can understand and how we can respond. So the stimulus are two: visual and auditory stimulus. Then there is a Wernicke's area, and for the motor activity to the respond there is Broca's area. Okay, this is all the pathway related to Wernicke's area. Now I can explain you the clinical importance when there is any damage to this area. What happens in the patient? Okay, if there is damage to this pathway, the Wernicke's area. Okay, if there is damage to the Wernicke's area, we can say Wernicke's aphasia. Okay, what are the clinical term related to it? Aphasia. Wernicke's aphasia. Okay. Okay, when there is Wernicke's aphasia, there is damage to the Wernicke's aphasia, Wernicke part of the brain. How it damage? First we know it. So when there is a stroke, there is any blockage in the middle cerebral artery, there is a damage to the Wernicke's area. Okay, because of not blood supply to the Wernicke's area, so Wernicke's area damage. Okay, so result Wernicke aphasia. What are the clinical feature in the patient? So there is not a damage in the Broca area. Okay, so the patient whose Wernicke's area are damaged and their Broca area not damaged, so the patient can speak. Okay, speak properly. Okay, but the but the answer of the question is wrong. Okay, because they cannot understand the input signals, okay, which come from the auditory and visual stimulus. They cannot understand the question. Okay, when you cannot understand the question, how we can answer? We must answer wrong to the question. So how the Wernicke's area involved? So the speech are good. Okay, he is speaking fluently. Okay, but the meaning of the speech is you don't know, not comprehensive. Okay, so there is a damage. This is the clinical importance related to Wernicke's area. The patient speak properly. Okay, but what he or she is speaking, no understand. What are the meaning of that sentence? Not understand. Okay, so this is the clinical importance related to that. So there is another name related to this condition, Wernicke's aphasia. We use another name. What are the other name of this disease, this pathology? What are the this neurological pathology is receptive. You have to receive information in the Wernicke's area, but here is a problem in the Wernicke's area. You cannot receive. So receptive aphasia is the other name of the Wernicke's aphasia. So guys, this is all about Wernicke's area, its related pathway, its related pathology, clinical importance, and the patient, how the patient perform in front of you. When you have to ask the question to the patient answer to you and speak fluently, but the answer is wrong. cannot understand your question, and so the answer is also wrong. He or she may speak any other thing, okay, and you cannot understand it. So this is all about the Wernicke's area, its clinical importance. So guys, I hope you understand my video. Please like, share and subscribe it, and press the bell icon to receive any new video, and please make the notes related pathway and clinical importance. Okay, so guys, be happy, take care.